Let me tell you how I work in my clinic. When a patient comes to me, he comes with a main complaint. Of course, we take the necessary time to listen what he needs to tell us, and in some moment we need to check him in the dental chair. In this moment, we prepared what we call the observation kit. This kit has a set of instruments that I'm going to show you. We have the mirror, we have the explorer, and we have the periodontal probe. This mirror is black because during this appointment we might need to do the intraoral scanning as initial record, and this mirror is the indicated for that. We have the explorer, that is an important tool to check if there is any carie or anything in the oral cavity that needs to be checked, and we added a very important tool that is the periodontal probe that will give us information about the periodontal condition of the patient. Why is this so important? Because if the patient has some type of oral disease, we should not start the orthodontic treatment right away. So I believe these three instruments are enough and really necessary for the beginning of the observation when we plan to do an orthodontic treatment to our patient.